Hi, I'm Dr. Jack West, medical oncologist from Swedish Cancer Institute in Seattle, Washington, and I'm also the founder and president of GRACE, Global Resource for Advancing Cancer Education. And I'm happy to be here for a post-ASCO 2017 update with two of my colleagues. With me is Dr. Matt Gubens, who is Associate Professor in Medical Oncology, Specialist in Thoracic Oncology at the University of California, San Francisco, and Dr. Jyoti Patel, who is Professor in Medical Oncology at the University of Chicago in Chicago. Thanks for joining us.
Thank you.
Thanks for having us.
Mesothelioma is an area that's also been very hard to develop advances for. One potential one is an agent called nintedanib. It's an oral therapy. It's actually a VEGF inhibitor, which means it's vascular endothelial growth factor. It blocks the tumor blood supply. And there was a study called LuMe-Meso that was a randomized trial of standard chemo with cisplatin and Alimta. It's been a standard for many years, either with a placebo or with this new therapy. That was not large, but it was meaningful, over 100 patients. And the randomized study showed that the patients did significantly better and lived longer, or at least a strong trend that way, with the combination of the VEGF inhibitor. What do you think of this? And there's a phase 3 study being done. Do you think this could potentially change practice?
So mesothelioma is a cancer in which there really hasn't been a significant gain for almost 15 years now. Alimta has been a standard of care. And we know that anti-VEGF agents have activity in this cancer. We know that Avastin's been effective for some patients. It's not been FDA approved. The nintedanib is a compound that works through a similar pathway, and this is a drug that's approved in the second-line setting for lung cancer in Europe. So we understand this drug, and in combination with a standard backbone for mesothelioma, I think it's effective, and I'm excited about it. I'm looking forward to the phase 3 results. Oral therapy is great, but it comes at a price. There was more toxicity, so there was more hematologic toxicity. Patients with mesothelioma are often symptomatic from their cancer. And so I think we really do need to wait for the phase 3 to see how it pans out.
I agree. In our practice, we have been using Avastin for patients who are eligible. It's only some patients are eligible because of other health conditions they have regarding their cardiac health or their blood pressure. But because it improves survival, we incorporated that when the European trial came out. But that said, it's a drug that's given even past the 4 to 6 cycles of chemo you got. So you're coming every 3 weeks for another infusion, as long as it works and as long as you're tolerating it. So there's definitely some inherent appeal to this group of patients maybe getting the same benefit from a very similar kind of approach or agent that's in oral form, so they can kind of decouple from the infusion center with hopefully very similar efficacy benefit. And if this does lead to approval, also helps us get it approved for our patients. We're asked. It's always a bit of a fight with insurance.
Right. This is a bigger phase 3 study, and if it shows what the phase 2 does, could lead to an approval and change things.
That's our hope.
What about also looking at mesothelioma? Immunotherapy has been looked at in previously treated patients, and there's some early promise with Opdivo or even an Opdivo and Yervoy combination. One study randomized patients between one drug and two drugs, showed some promise, but these are early days. Where do you think there's a potential? Is there a role for immunotherapy, one of these agents, or even two, in previously treated mesothelioma?
So with mesothelioma, we know that there are high levels of PD-L1 expression. So it's nice that we have a biomarker, and we've actually shown that the drug affects the outcome. This was an early study, but it proved a couple of important points. One, that probably two drugs was more effective than one drug. The toxicity, I think we're getting a handle on. Again, patients with mesothelioma often have other comorbidities or other factors that make delivery of treatment a little bit more difficult. But certainly I'm excited for further investigation. We know that a similar drug at last year's ASCO in 2016, a drug that was similar to Yervoy, tremelimumab, was not effective. So it's likely that the PD-L1 inhibitor, or the PD-1 inhibitor, the Opdivo, is going to be an important part of the treatment algorithm.
Right. completely agree, and I'm excited to see almost all these mesothelioma trials are accruing very rapidly. So it's very gratifying that this patient population, which really has been marginalized in thoracic research, are really seeing some meaningful advances in these drugs. They're really at the table and getting study results, and I think really will have a role for immunotherapy in their treatment. And certainly in your shop and our shop, we're really excited about other immune approaches going forward. So really important area.
It's a minority of patients who may have a great response or even a very good one, but having anything and the option and the possibility of patients doing well for an extended period is a great development. And as you say, having even things to talk about in this field that has been very hard to come by some new options. Thanks very much for joining me. Appreciate it.
Thank
Thanks
you.
for having us.